So you just heard that your baby is lying breech and you're freaking out. Okay, don't stress. There are a couple of things that you need to know about breech. First of all, it depends how far you are in your pregnancy. If you are early days, before 34 weeks, you shouldn't worry too much. Babies normally settle in their final position between 34 and 36 weeks in pregnancy, and whatever position they are in then will most likely not change until you go into labor. So what is breech? Breech means that the baby is presenting with their bums first. Presenting means the bums are going to be first in going into the vaginal canal when you go into labor. So why is this a problem? First of all, let's understand what breech actually means. So this is mom's pelvis. This is the placenta. This is your baby inside. What normally happens is that the placenta, this part attaches to the uterus. And most placentas will be in the top of the uterus, so right about here. And the baby will then descend into the pelvis. Most babies are born with their heads down. This is the way a vaginal birth happens. But 3 to 4% of all full-term pregnancies turn out to be breech. And in that case, instead of the baby going in like that, this little baby inside is very determined to not do things the normal way, and they present themselves with their bums first. So the placenta might be up here and they want to go into the birth canal bums first. Why does it happen? So there are certain risk factors that will put you more at risk of having a breech baby. These are preterm labor, so you're not full term yet, which means the baby is still moving around, but you've gone into labor and now the baby was in a breech position at that point in time. Then fibroids in the uterus. So fibroids are growths in the uterus and they might prevent the baby from turning head down. So they stay in a breech position. Multiple pregnancies, so if you have twins, triplets or more, then the babies will try and find a good position and they might get stuck in a certain position because they run out of space sooner than other babies would be if it was a singleton pregnancies. So if they were in a breech position, then they will just stay in a breech position. So then if you have an odd-shaped uterus, babies might not be able to turn nicely to turn head down. And then if you have too much or too little amniotic fluid, so the water around the baby, if it's too much, it's called polyhydramnios. If it's too much, this baby has all the room in the world to float around and decide which position she feels like going in today. If you have very little water, which is called oligohydramnios, it means the baby runs out of space early on to try and turn because there's not enough water to give the baby space to find her way and her head down. The last two factors is a low-lying placenta. So where I said that the placenta is normally up here, it can even be anterior, which affects fetal movement. Or it can be low-lying placenta, which means the placenta is preventing the baby from going into the birth canal, that the baby cannot turn nicely because the placenta is in the way. The last one, which is not that common, but it can happen, is a really short umbilical cord. So this baby, there's the baby's umbilical cord. If this cord is really, really short and the baby has been chilling like this for most of the pregnancy and now the baby wants to turn down, this movement of the baby having to turn away with a really short umbilical cord, it might prevent the baby, or it is not necessarily that the cord between the baby and the placenta is so short, but the cord might be wrapped around legs and around an arm, and now if the baby wants to turn, they just can't. So they just stay in this position because it's comfortable. So can breech babies be born vaginally? They can, but the type of breech needs to be considered. So there are 3 types. The first type is where the baby, now this baby is not that flexible, but the first one is a complete or flexed breech. That means, and I'm going to show with the baby if I can, but it's very stiff. So just look at the picture that I'm showing you here. This is the only breech that is considered safe to deliver vaginally because the feet and the bum are at the same level. So if the mom was pushing, both the bums and both feet will be able to be delivered. In a frank breech, the feet are high up here, basically like this. And some babies do get born like this. The problem is this is a very abnormal position for the babies, for their hips, and you actually want to avoid them being born vaginally through a tight space with their feet up here. It's basically like your legs going up here because they're very prone to hip dysplasia afterwards and they might need some treatment to fix that. The one that you do not want to deliver at all is a footling breech. This one is 1 foot of the baby is presenting. So if I feel, this is my pelvis. This is what we feel. We feel a little foot. You don't want to deliver this baby because you don't know where the other foot is. The other foot might be right here and might want to come out, but the other foot might still be up there. And how are you going to push this baby out with 1 foot here and 1 foot at the bottom? You're going to end up with dislocations or injuries to the baby, for sure. So back to the question. Can you deliver a breech baby vaginally? You can, but the risks are significantly higher than if the baby was head down. Why? Because of these factors. So number one, the biggest part of a baby's body is their head. So if they are head down and the head is delivered, you know that the biggest part of the baby can fit through the vaginal canal or the birth canal. So the rest of the body will fit through. And you can only deliver the head if the mother is fully dilated. If the baby is breech, with the bum and the feet in a complete breech, it's still soft, it's tissue, it's not bones like the head. So this part might fit through a cervix that is not yet fully dilated. So now you have a baby delivering, but you have no way to know whether the head is going to fit or not. That is a true life-threatening emergency if a baby's head gets stuck. The other risk factor is that the baby's shoulders might get wedged in the mother's birth canal. Baby might go through here, and then in the inlet here, the baby's shoulder gets stuck and they can't maneuver nicely to come out. In the process of trying to get a baby that has started to deliver breech out, you might end up with injuries or dislocations like I mentioned before. But one of the biggest risk factors for babies in breech position is a cord prolapse. And that is the placenta is up here. Now the baby is breech. And she's going here. If the waters have broken and there's nothing here and you just see the bum and the foot, you can potentially attempt to deliver vaginally. If the waters of the baby did not break yet, and that happens during the delivery, because it's a gush of water, the cord can slip through. Now if you compare it with a baby's head is round and it covers the cervix, so even if the water breaks, nothing can really come past the baby's head. But the feet and the tummy is not round, it's uneven. So it's very easy for a cord to prolapse and hang outside while the baby is still inside, like here. And the moment a cord is outside with the baby inside, you're running into problems which can be fatal. Because every time the mom gets a contraction, this part is cut off from oxygen. So instead of the cord being inside and the baby getting all the blood and nutrients when mom has a contraction, now the baby is cut off from blood supply completely during a contraction. And depending how long it takes to get that baby out, this might not be enough to prevent the baby from going into fetal distress. So the ideal for breech babies is to deliver via C-section. In a case where a mom has had previous vaginal births and she's coming in presenting with a breech delivery fully dilated, the doctors and the midwives are more likely to let her deliver vaginally because she has given birth before, so they know her pelvis can accommodate a baby through the birth canal. If it's your first baby and it's a breech presentation, you will struggle to find a healthcare provider that will support you to deliver the baby vaginally. Even more so if you're considering a home birth and the baby is breech. Home births are only considered safe if the baby is in the head down position, but no one is going to stop you if you want to try that. You just need to understand the risks. So now the question is there something that you can do to turn this little stubborn baby upside down? You will find lots of resources online that will claim that these positions help, and you are more than welcome to try any of those. But there is no scientific backing to show that these do actually work. These tips and advice include things like standing on all fours, lying in a bridge position with your hips elevated, going for acupuncture, seeing a chiropractor. They have a method called the Webster technique that they love to do, playing music at the bottom of your tummy to lure the baby to go and listen there, or placing something cold at the top where the head is and something hot at the bottom to make them uncomfortable. These are all things that you will find online. None of them have been proven to be scientifically relevant that they can turn a breech baby. The only scientific evidence is called an ECV. It's called external cephalic version, and it is a doctor turning the baby in your stomach, which means as your baby is lying like this, from the outside they will try and turn the baby. It is an uncomfortable procedure and there are risks involved, which I will cover in another video, But they basically push the baby from the head down, and this side push there on both sides and try and turn the baby. It has about a 50% success rate, but many of those babies end up turning back. So then you know there's a particular reason why this baby keeps turning back, and you might never know exactly why. If they do this procedure, it is not done in the doctor's rooms. It is done in hospital and close to a delivery room. They have to monitor the baby's heart rate throughout, and they have to have an ultrasound there to check if everything is still okay, the baby's heart rate is fine, the placenta is fine. But the reason you have to be close to a delivery room is if there is any complication and they have to take the baby out immediately, then you are right there and they can do a C-section, no problem. Let me know in the comments if you had a breech baby, when the baby turned, if you had ECV, was it successful or not, and how many of you had a successful vaginal birth with a breech baby. Thank you for watching. I'll see you next time.